Lady and gentlemen, you're most welcome.
Thank you.
Thank you.
Great to see you. You know, the way you smile, sometimes I've done this program for so long, but sometimes when I look at the way my guests smile, people ask me, are you guys sure you're talking about diseases and conditions? But it's great to have you. Actually, Steve, you've retired now.
Yes.
That's why now the second silver in your hair and the beard is showing. But that's a blessing.
Thank you.
Yeah, very often we neglect to honor our civil servants. I know a couple of weeks back, Dr. Justina Tete, Dr. Justina Ansa. Calling her maiden name. Yeah, she's left the blood service as well. Steve is on his. Well, we pulled you out, as the police will say. But you're most welcome, and Dr. Siaka Kwawu, you're welcome.
Thank you.
Many people may not. They hear of the national program on immunization and all that, but the national program on viral hepatitis, we don't hear that much about the program, do we? Oh, it's me.
Thank you very much. Good afternoon to your listeners. The program's name is National Viral Hepatitis Control Program.
Control Program, right.
Yes, it's probably the youngest program also in the Public Health Division.
Okay.
It was established in 2011.
Right.
And it's been working ever since. It's been part of World Hepatitis Days every year since till... I must say, during the COVID time, there was very little outdoor activity from outside.
Okay.
So maybe that may have accounted for
right.
You not having heard
okay.
much. But we exist.
I say that sometimes to pull you out. I know there's a national policy outlawed in 2015 and I think renewed in 2019, yeah? We have a policy
and guidelines.
And guidelines, right? Okay, yeah. We're well aware of you, and you're welcome.
Thank you.
Hepatitis, I mumbled a definition of sorts for my listeners, but I always hand it over to you, Dr. Adjoa Jane Cancer. I mean, you're a hepatologist, right?
Yes.
So this is your territory.
Yes.
Right? Just give us a breakdown for my listeners, the benefit of my listeners. What is hepatitis?
Okay, when we talk about hepatitis, we're talking about inflammation of the liver.
Okay.
Inflammation appears to be a big word, but when there's an insult to the liver,
right.
there's a response, and that response sometimes can lead to destruction of the liver.
Okay.
So anything that will cause the liver, that will insult the liver in a way, will result in inflammation,
right.
such as alcohol, the viral hepatitis, now even the type of food we eat and some medications. But based on this, we're talking about the viral causes, the viruses that inflames the liver. Okay. That is what we mean by viral hepatitis.
Right. Okay. So I like the word. I like the way you put it. Insults to the liver. Right. Sometimes we think we're doing the right things, but we are insulting our body and the organs and the systems within our body. So you are threatening trauma to the liver of sorts, right?
Yeah.
And you've mentioned quite critically and indicative for us that we're talking about inflammation triggered or caused by viruses.
Yes.
All right. So this is a viral disease.
Yes.
All right. That we're dealing with viral hepatitis, and there are several types, aren't there?
Yes, we have about 5 common types, namely A, B, C, D, and E.
Right.
Now, the interesting part is that A and E usually causes acute infection.
Right.
So the body is able to get rid of it.
Okay.
But when it comes to B and C and D as well,
right,
it leads to chronic inflammation. And that is what leads to the complications that we are mostly scared of.
Okay.
Yes. So our emphasis is mainly on B and C.
B and C.
Yes.
Right.
D, we don't talk much about it because you need the presence of B for D to be established in the body. So if you don't have hepatitis B, there's no way you get hepatitis D.
Wow.
So D, to remember, is dependent on B. Yes.
This alphabet is tough. Right? Folks, if you just joined us, you're on Ultimate Health on Joy 99.7 FM. We're looking at hepatitis, and there have been a range of activities to mark World Hepatitis Day, and the awareness campaigns are, on the go, and I've got the guests in the studio, the specialists in the studio, to talk about hepatitis, the different types, the tests, the causes, even the conclusive diagnosis, then treatment and vaccination. They're very different things, very distinct things, and I've got guests in the studio to help us do that. Okay, so there are different types, and our emphasis zeroes down to B and C, right? Let's just briefly, hepatitis A, that is a more acute form. You say the body is capable of dealing with it, so it probably sorts it out and it goes away, right? But what are the causes of hepatitis A? Is it also viral?
Yes, hepatitis A and E, they are both viral.
Both viral.
But the mode of acquisition, how one acquires it, is different.
Right.
A and E is mainly through contaminated food and water.
Okay.
Yes, so when the food is contaminated by the virus, then one can take it, unlike the B and C, which is usually blood-borne.
Right.
I mean, it should go through, or there should be blood in it for one to be infected.
Okay, get that clear, right? Typically foodborne, A and E, right? Hepatitis A and E.
Yes.
And this is why those in the catering industry, the hospitality and so on, they're required to have a clean bill of health when it comes to hepatitis and other things.
Yes,
right?
but the emphasis when it comes to food should be on the A rather than the B.
On the A, right.
Yes.
Okay, great. We understand that. Okay, so Steve, a lot of the information, education given out there is about B and C. And Dr. George in Cancer is telling us those are the ones of serious critical concern, right? Why the concern about hepatitis B? She mentioned that can move on from the acute form, which the body can try and deal with, to a chronic form. So what's the concern with hepatitis B?
It has become a public health concern, basically because, as Dr. Adjoa said, the chronicity,
right,
and the fact that eventually, if care is not taken, after some couple of years, the patients might end up getting what we call hepatocellular carcinoma, or what we say cancer of the liver.
Right.
And it has become so concerned that the prevalence every year, we see people dying of hepatitis complications.
Right.
As we speak now, the prevalence in Ghana, if you take 8 people, one of them will have hepatitis B.
Right.
If you take 10 people, 30 people, hepatitis C, one of them will have hepatitis C.
Right.
And as she said, most people will not have the symptoms at all. And so they will be walking around without knowing that they have hepatitis B or C, unless they go and test.
Right.
For a few people, they will have the acute symptoms like malaria-like symptoms. I was just telling Dr. Adjoa that 2 days ago, I had this client who came to my premises, and she was complaining about malaria-like symptoms. I've been treating malaria all this while. So out of curiosity, I said, just go and screen for hepatitis. And he screened, and his hepatitis B was positive.
Right.
And I asked him, have you done the screening before? So he did it 2 years ago, and it was negative.
Okay.
So we are saying that this year, the team is bringing hepatitis care closer to the community.
Right.
Previous years, we'll be talking on national, we'll be dealing with hepatitis throughout corporate organizations and things.
Okay.
But we are not getting the results. And the fact of the matter is, WHO, with all other countries, have put up 2030 as the day to eliminate hepatitis eventually.
Eliminate?
Yes.
Whoa.
And we are in 2022. So we have 8 years left for us.
Okay.
So we need to do more.
Right.
To make sure that the awareness is created, people go and test for it, and then they will be screened. And if they need to vaccinate, especially for hepatitis B, you can vaccinate and get 95% immunity.
Okay.
For hepatitis C, we also have realized that people can now be treated eventually and they can get the hepatitis C out of their system.
Okay.
So what it is happening now is that if you are not doing much in terms of screening, and we are not doing much in terms of making people come together to come and do the testing and then vaccinating, then we will have the situation getting worse and worse.
All right, great stuff. 19 minutes past the hour of 2 on Joy 99.7 FM Ultimate Health. We're talking about hepatitis, and interesting numbers you put there. I was doing some reading before the show. I saw some prevalence rates about 12 point something and so on and so forth. If you relate that to our population, that's a serious public health concern. Dr. Siakekwa, these are, to me, staggering numbers, right? How do we compare with other parts of the world when you look at the prevalence of hepatitis? Steve just shared some numbers, and also we'll go back to the symptoms, because we said many people do not have symptoms, and therefore they're walking around with hepatitis and able to transmit hepatitis, and we got this sub-radar, right? Are these numbers, should I say, typical, normal for a country like ours in our sub-region? How do we compare?
Yeah, thank you very much. Hepatitis, as it were, has become a problem of the developing countries in sub-Saharan Africa. When you take the Americas, the prevalence is very low.
Oh, okay. Why the Americans?
Oh, yes, Americas and the Europe.
Okay.
Yes, the
what would account for their low prevalence?
They have recognized the disease much earlier.
Okay.
They started working on it. And these are societies where, when there are new innovations, products, I mean, they tend to originate from those.
Right. And they put their money where their mouth is.
And there is a strong movement to make sure that they address hepatitis. And they've been doing it. When you say movement, are you talking about a national or state commitment?
Yes,
stakeholders, various interest groups, state will behind it, and they have been doing.
Okay, let's leave America and come back. So it means we lack that.
When we come to this, our country, Ghana is classified as a hyperendemic. In other words, our level of prevalence is more than 8%.
Wow.
So it's
hyperendemic, not just endemic.
So it means that we are above a certain threshold. And when you are above that threshold, actually, it means that hepatitis, the hepatitis problem is being fueled by mother-to-child transmission, not just an issue of somebody getting it from blood transfusion or use of contaminated instruments for body.
So essentially, our situation is quite precarious.
Yes,
and it's alarming.
Yes, we have to make sure we cut this fueling by mother to child.
All right, flatten the curve.
Yes, yes.
Right. Okay. So Ghana sits in, should I say, a difficult position when it comes to hepatitis, right? And this has been noted. We have a program of control for this disease, and yet we are still in that position. And Steve mentions that we are not having or making the impact required, right, to meet the target set for 2030. All right. Now, let me come back to the symptoms, okay? He mentioned some of them, Dr. Aduaje. He mentioned malaria, flu-like symptoms. How would I know, or what would cause me to suspect that I may have hepatitis?
Okay, thank you very much. Most of the people with chronic viral hepatitis do not have any symptoms at all.
Okay.
And the only time they are picked up is when they develop a complication.
Right.
That is when the liver is cirrhotic, meaning that most of the liver has become like a scarred tissue.
Right.
And therefore not performing its functions or has developed liver cancer. However, if the first time one gets exposed to the virus as an adult, then because the defense system is quite strong, there's a fight between the defense system and the presence of the virus.
Okay.
And that is what the patient may present with nausea, vomiting, jaundice, feeling very weak, very lethargic, etc. Then that is what we mean by the acute hepatitis
Acute
stage.
hepatitis.
Yeah, of
Okay.
the disease.
Right.
The other thing with the elimination I want to add on is when WHO sets up the target that 2030 there should be elimination. So we are eliminating it as a global health threat.
Okay.
And there are indicators for that. That the new incidence should be reduced by 90%. And then when it comes to mortality associated with the disease, the viral hepatitis, we should be able to reduce it by 65%. So that is what we are defining as elimination by 2030.
Okay.
Yeah.
Right. So I can hold and program to these targets and say, well, so currently, what is our mortality? How many people are dying of hepatitis and related complications, let's say, in a given period, right? And then we can also look at how many new infections are we getting?
Exactly.
Right. So when we look at the tail of the tape there, how are we doing?
So with the introduction of the pentavalent, that was introduced about 20 years ago, new incidents have reduced. Okay, we don't have the national data.
Okay.
But the assumption is that there's still more to be done, even with the vaccination.
Okay. The introduction of pentavalent you mentioned,
Yeah.
just explain that, break it down for my
Okay,
listeners who are
so-
not hepatologists.
Sorry. So
Yeah.
when we talk about the pentavalent, there was a time we made so much noise about 5-in-1 vaccine.
That's right.
Yes. So that 5-in-1 vaccine contains 5 vaccines. That also includes hepatitis.
Okay.
So that was what was introduced 20 years ago. So
Okay.
all those who were born around the time and who had the vaccination had it.
Okay.
But now we have realized that it is not enough. There's still more to be done.
Okay.
And that is the introduction of the birth dose we are waiting.
Right.
When it also comes to the epidemiology, I want to add a bit. Now, when you take sub-Saharan Africa, we are hyper-endemic, as you said, more than 8%. Now, America, Asia is also another hyper-endemic place. The Europe and Americas, they are fine.
Okay.
And one of the reasons being that they introduced this vaccination many years ago.
All right.
So it is no longer a public health problem per hepatitis B. But they are fighting more against hepatitis C. But we is the B that is teaming in our
All
country.
right, great stuff. If you just joined us, 26 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, we are live with all the precise, accurate, up-to-date, unassailable health information to protect you. If you have any questions, concerns, you can grab us on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. My guest, Dr. Adjoe J. Nkansa, consultant physician, hepatologist, senior lecturer with the University of Ghana Medical School, and a member of the Hepatitis Technical Working Group, and they are working. All right. Dr. Achu Godwin Siake Kwewu, he's the program manager, National Viral Hepatitis Control Program. You may have some serious questions for him. And the one giggling is the retiree, Stephen Kokwe, senior specialist clinical pharmacist, formerly with the Kolibu Teaching Hospital. But he's a fellow of the Ghana College as well, and a member of the Hepatitis Society of Ghana. All right. So we've got these indicators. We mentioned mother to child, which means a mother who has hepatitis can pass this on to her child,
Yeah.
right?
Yes.
Okay, so that's mother to child or vertical transmission.
Yeah.
All right, and we're also engaged in methods and means to reduce that. Okay, or are we able to reduce mother to child transmission?
Yes.
Yes, we are.
That's our target. Yes.
Right. Okay. And then this is something I want to hit on before we move to other things. The concern focused on B and C. Now, when you read about viral hepatitis, there's a big chunk of it which says it is sexually transmitted. Right? Can we address that? Right? I mean,
Okay.
blood and blood products,
Okay.
right? Body fluids and so on and so forth. Can we clarify that? Some years ago, I had somebody on my program, and a question came about, so if you sit in a trotro or a taxi, or should I say Uber or Yango, with somebody who sweats, can you get hepatitis? So let's look at the mode of transmission, and this big chunk which talks about sexual transmission of hepatitis.
Okay. Thank you very much. When it comes to mode of transmission, it is also related to how endemic the virus is in your country.
Okay.
Because we are mainly hyper-endemic, our mode of transmission is vertical transmission, mother to child.
Mother to child.
Yes.
All right.
So most of us will be exposed to the virus before we become even sexually mature.
So you're born with it.
Yes. So through birth,
Right.
that is where the blood exchange occurs.
Okay.
Yes. But when you take those who are outside where it is not that endemic, they grow up. So when you read like Google, etc., in terms of places with low endemicity, sexual transmission is there. But in our part of the world, about 60 to 70% or more is from mother to child.
Okay.
And then what we call horizontal transmission.
Right.
Households sharing various things, especially sharps. That can like using razor blades, sharing toothbrushes because of the blood, etc. But things like plates, using cutlery will not transmit the infection.
Okay.
Sweat will not transmit the infection. I always tell people otherwise I'll be teeming with the virus because most of my patients are hepatitis positive who comes in a hot consulting room
Right.
sweating.
Okay.
Yes. So casual contact will not infect you.
Okay. All right. Can I pin it down further and ask about risk factors? Who is more likely after, you've said 60 something percent, it is mother to child, but who is more likely to develop viral hepatitis and then progress to the chronic stage? What are the kind of things we're looking at?
Okay, so one, it is the amount of virus in the mother's blood.
Okay, viral load.
So the more virus you have in your blood, that's the viral load.
Okay.
The easier it is, or the more it is that you're going to pass it on to the next person or to the child.
Okay.
Another risk that we also look at is that, for instance, people who use sharps, the tattoos, etc., if these needles are not well sterilized,
Okay.
it predisposes them. Drug addicts, because they exchange needles.
Injecting drug
They
users,
using
IDUs,
yes.
right.
So they tend to share lots of needles. They jab and then pass it on to the next person. Yes, and then once you jab yourself, there's definitely going to be blood on the needle.
Okay.
And as you inject, you're also inoculating the virus into your system. So
Okay.
that is another risk factor.
Right.
The other risk factor that was mainly for hepatitis C was during dialysis. These are rare cases,
Right.
though. Yes, that can also predispose one to getting the infection. Manicure, yes, but as I said, our main emphasis is on mother to child in
All
our
right.
part. Yeah.
I don't know. I'll ask the other two gentlemen, but are we going soft on sexual transmission, multiple partners, or serial monogamy, as they say? Monogamy is serial, right? One person, but the other person doesn't know, so it's monogamy. It's sexually transmitted as well. I don't want to finish the program with people saying, "Oh, thank God!" Right. So we're good to go. The doctors said it's cool, and it's really mothers who are giving it to their children without referring to where the mothers are getting it from. So sexual transmission, Steve and Dr. Siakakwao, can we talk about this a bit? I mean, I see it in the literature. It's there. Are we deliberately playing that down, or what should I say? Or what should my listeners hear?
Yes, as Dr. Dua said, most of the time, with these high endemicity areas like Ghana,
Right.
it is the vertical transmission and
Okay.
the horizontal.
All right.
But we also have sexual transmission. Sexually, people with multiple sexual partners.
Okay.
And then we also have homosexuals.
MSMs, right?
Yes, who can also transmit. In certain countries, homosexuals have transmitted hepatitis C and B.
Men having sex with men.
Exactly.
All right.
So it is not a no area. I mean, people should know
Right.
that if you have one sexual partner, the transmission is very low.
All right.
But if you have multiple sexual partners, then you are at very high risk of getting hepatitis B or C.
All right. My job. Folks, if you just joined us, it's 33 minutes past the hour 2 on Joy 99.7 FM. We're breaking down hepatitis. We want to understand the types, the tests, the causes, right? My guests in the studio are doing just that. If you have any questions, concerns, WhatsApp is 055 11 997. We're live on Facebook and YouTube. Shortly, I will activate the phone lines so you can ask the questions. These days on Ultimate Health, with advancing age, I take my time. Sometimes I even do two programs on the same topic, or 3, so that you can get the APO properly and protect yourself. So if you have any questions, send them to us. I've got a couple on my WhatsApp. Let me just see. This one says, 2 of my children were immunized at 10 and 11 years ago. Are they safe? I'm Chief from Boma. Right. Okie dokie. We'll come back and answer those. Good afternoon. My partner is hepatitis B positive. Though I took a vaccine before marriage, is there any advice for me? Do I still stand a chance, all right, of contracting hepatitis? This is Nana Kwame from Cove Town. Can we note that? Thanks, Nana, for sharing. This one says, good afternoon. Please, can one still get hepatitis B after taking the vaccine, right? You probably heard Steve mentioning about 90% upwards of protection if you are vaccinated.
95%.
95%. We'll look at that. Vaccination is a whole program, and I need people to understand. We'll take our time to look at that if we can touch on it today. Please, is HBV curable in this technological world? And what kind of food substances? Thing with food substances and can patients take? This is Dagati in DC Petroleum. Food and hepatitis. Okay. So yeah, there's a question about vaccination. Somebody's partner is positive. They have vaccinated before marriage. I don't know how long ago that was. Are they safe?
Yeah. I want to say that normally, under normal conditions, there's a very high level of protection from the vaccine once you complete the series.
All right.
It's not just to take a jab and say you've taken vaccination.
Right.
You need 3 doses,
right,
to be able to do that. Now, under normal condition, most people, 95%, are protected.
All right.
It may happen also that the body is unable to uptake to assist you to develop the kind of immunity you
were looking for. Right.
So in his specific case, if he's not sure, there's a way to do it, is to check the profile.
All right.
Whereby they will check to see whether he has got sufficient immunity.
All right. So we're assessing your immunity
exactly
over
against
time.
the disease.
All right, and this can be done.
Exactly, it can be done.
Okay.
It can. Then that is what will enable
I have a question for you.
The person to be assured.
In the absence of that, I'm butting in with this, all right? In the absence of that, would you say or recommend that if you are aware of your partner's positive status, you should be having protected sex?
Yes, of course.
Oh, don't whisper it.
Yes, of course. That is true. You should protect yourself. If you are unable to know your status, but you know that of your partner,
right?
Yeah, you should protect it. Just like we recommend for HIV/AIDS.
Right.
It's very important to do that.
Great stuff. All right. Good afternoon and bless you, Nortey. Welcome to my home. Oye in Afienya. Oye, I'm always in your home, Charlie. It's the food that I don't get to eat. Right. This one says, hello, Nortey and team. Please, is it possible for someone to have hepatitis B and not be able to transmit or not be in an infectious mode?
Okay.
Right.
I would make a little comment. Now, if your partner has the virus and you have had the vaccine or you don't know your vaccination status, one of the things to do is to look at the amount of virus in your partner's blood. Somebody may test positive, but the amount of virus in their blood may be so low.
Get your partner to test and
those who are positive,
ascertain their viral load.
Yes.
All right.
Because if it's very minimal, there's no risk. You can have your children without any problem.
Okay. Right.
Now, the viral load is a bit expensive. So in that case, there's what we call hepatitis.
Hang on, the viral load test is expensive.
Yes.
Okay.
So you can do the hepatitis B E antigen test.
All right.
If it is positive, it's a surrogate marker that the amount of virus in the blood will be very high.
All right.
So that tells
it's a proxy.
you. Yes.
And it's a cheaper test.
It is a cheaper test, yes.
Okay.
So for you, I don't think that you should necessarily be using condoms throughout. You are married, you want children, your partner is positive, you are negative. You can just go for the vaccine and then enjoy your marriage.
All right, great stuff. 39 minutes past the hour of 2 on Joy 99.7 FM. Lots of stuff there. Follow-up questions. It's like Parliament, Mr. Speaker, right? But interestingly, let's come back, right? We responded to questions, so we went a bit away off my path. But so what is the conclusive test? I mean, there are signs and symptoms. I think we mentioned jaundice, yellowing skin or eyes, and so on and so forth. Somebody did ask, I think I haven't read it, whether all yellowing of eyes and skin is related to hepatitis and can be called the same jaundice.
Jaundice can occur as a result of liver problem,
right,
or may not be related to the liver at all.
Okay.
For instance, for sickle cell disease patients, as they break down their red blood cells, they develop jaundice. That has nothing to do with the liver.
Right.
So not all jaundice is equal to hepatitis.
Okay. Dark urine?
Dark urine, if you are jaundice, you have dark urine. It could be that you are breaking down your red blood cells from infection, sickle cell, or some drugs you have taken, and not necessarily, though hepatitis can do similar thing, it is not necessarily due to hepatitis.
Okay, so the only conclusive way of diagnosing, right, is to have a test.
Yes, is to have the test done.
Okay.
And the test is hepatitis B surface antigen test.
Right.
HBsAg.
Right.
Yeah.
Okay, so when we do these workplace screenings and all those things, is that what we're doing?
Yes, that is what we use.
All right. So there, many people say you are screening, but once it is detected to be positive, then that's conclusive. You have hepatitis.
So once it is done, because we are using a rapid method,
right,
we usually would want you to do another blood test, which is confirmatory.
Okay.
So it's another form. Either you do the ELISA test.
All right.
That also tells whether it's positive or negative, or we look for the virus in the blood.
Okay.
Yeah.
Folks, it's 41 minutes past the hour already of 2. We're talking about hepatitis and we're being a bit detailed about this. My phone line is active 0302216541. You can ask the questions of my guests in the studio. We're talking about hepatitis, types, causes, tests, right? Treatment and vaccination, I'm very keen on separating them so that we can do full programs on that, because many people start and default, and then they start and then they say it's expensive and so on and so forth. We will give you the full Monty, right? If it is expensive, we'll tell you, but we'll tell you why it's expensive and what you stand to gain, right, by doing these things. Very often people look at the cost and say, oh, since I'm walking around and I'm fine, Steve, Ajwa, and Godwin, they are just prophets of doom, right? So we will separate and distinguish treatment and vaccination. Okay. So my phone line is active 0302216541. Already my line has had a hit. Hello, good afternoon.
Good afternoon, Nortey and
Right. Who am I speaking to?
Amy from La Paz.
All right, Amy, share with us.
The difference between the viral load and viral profile or something. 2 things were mentioned. I want to know the difference, please.
Okay. Right. You see my listeners, my discerning listeners. She wants to know the difference between viral load and then the profile that Dr. Kwao mentioned as well. What's the difference?
So when we take the viral load, it tells us the amount of the virus in the blood.
Okay.
It is a test that is able to pick up the virus. So it counts it per meal and then tells us this is the amount of virus in the blood.
Okay.
Now when we take the profile, it's made up of different tests all put together. One is the surface antigen. And the surface antigen will tell you whether you've been exposed to the virus or not. So if your surface antigen is positive, it means you have been exposed to the virus.
Okay.
The other thing is the E antigen. The E antigen, when it's positive, tells you that the viruses are reproducing a lot.
All right.
And they tend to have lots of the virus in their blood.
Okay.
And then we have what we call the core antibody test. And the core antibody, we have 2 types. We have the IgM. Anytime you see IgM, it picks up acute infections. And then the IgG is for chronic infections. So when we take the profile, these are the things we are looking at.
Okay.
Yes.
All right. So we're not just doing these things ourselves. These are tests and investigations that must be requested by a qualified professional.
Definitely, yes.
Right. You don't just enter a place and say, I want
My profile done.
surface antigen and IBFF because Adra J said so.
No,
Right. So
no.
these must be requested.
By a doctor,
qualified
a physician.
doctor.
Yes,
Right.
a medical person.
All
yeah.
right. Okay. So my phone line is active 030-221-6541. There's a caller on the line. Hello.
Yeah, hello.
Yes, good afternoon.
Good afternoon.
Right. Share with us. Who am I speaking with?
I'm calling Brian.
Ibrahim.
Yeah.
Okay, go ahead. Share with us.
Please, I want to know whether treatment for the virus is it free or is it that much costly? Because those who don't have, we know that we have the virus, but going for the treatment, we don't know what it shows like with this paper.
Okay. So he wants to know whether the test is free. Right. Now, when we were talking about our numbers, okay, and whether we're making progress, this was one of the things I wanted to bring up, right? The access to treatment and care, because we said bringing hepatitis closer or bringing hepatitis care closer. So we will have to examine the barriers to this, to the attainment of this target, right? Is it cost? Is it this? Is it that? And so on and so forth. Okay. For example, we're talking about mother-to-child transmission, right? Are we routinely testing pregnant women and so on and so forth? Okay. So he's asking, is the test free?
The test is not free.
Okay.
It's, as Dr. Adwa said, it's a little expensive.
I don't like that. If it's expensive, it's expensive.
The routine tests, even the hepatitis B surface antigen,
All right.
have not been captured by the health insurance.
All right.
Although we are told that it is in the health insurance list, we are yet to find out whether.
So how much does it
people-
cost to test and screen for
the,
hepatitis?
The test of hepatitis B surface antigen, the lowest you can get will be about 30 cedis.
30 CDs.
Yeah.
All right. And you're talking about properly registered and whatever lab.
Yes.
Okay.
And as for the viral load, I think it's about, we are getting to somewhere around 1,000 cedis.
To check your
600.
6,600 or 600?
No, 600.
600 CDs.
Yeah.
All right. To test your viral load. Okay.
And all these things are not in the health insurance.
All right.
And so for somebody who have hepatitis,
But with the numbers we're talking about, it will break the health insurance.
exactly. But you see, other countries have been able to do these things.
Okay.
Bring it down. If it is, if you are serious about eliminating hepatitis by 2030, then we have to look at some of these costs.
Okay.
Because when the person tests hepatitis B positive,
All right.
and you say you should go and do the profile, which also have a cost implications.
Okay.
And then you say you should go and do the viral load, which also adds up to it.
Right.
And then there's another one, we call it abdominal ultrasound,
Right.
which also have a cost implication. All these tests are very important for the doctor to make a
All right.
decision.
Steve, I have a call online. Let me take the call up. When I come back, I want to zoom with you and the program manager, because we have a national policy and guidelines. What does it say about where we are heading with regards to financing these things? All right. It also puts us in a position where we must be doing a lot more prevention. But hello, good afternoon. Hello, good afternoon. Hello, good afternoon. All right, seems I lost the caller. Okay, right. So it means treatment is expensive, right?
It is.
All right.
No, the test itself is expensive.
Yeah.
Before we come to the treatment.
Okay. So, Dr. Siakekwa, does our policy tell us where we are going when it comes to this? It's great to say other countries have done this and that and that and that, but what do we have laid out in our policy?
Yeah, thank you very much. Our policy currently is for risk-based testing.
Okay.
That is, people who are exposed to specific risks can go and require testing.
Okay.
Even though in our treatment guideline it is added that anybody who presents himself and requests for testing can be tested. Actually, what it's telling us is that we need to be very clear about our testing policy, testing recommendations, which we have to work on.
But if you recommend,
yes,
it's not mandatory, is it?
Yes, as part of elimination, we need to be very clear about who we are going to test, where they can test, what kind of test they should use, and then who bears the cost. Because he's talked about hepatitis B surface antigen being about 30 cedis per person. The moment you go and do 100, 200 people, it's a huge cost. And then who bears the cost? These are all national discussions that must be.
They still remain
agreed.
discussions.
Yes.
Okay. All right. Hello. Good afternoon.
Good afternoon.
Right. Who am I speaking to?
Amy again.
Amy again. Go ahead.
Yes. Please, I'd like to know when the E antigen is positive, like she said, is that what they say is whatever, malignant hepatitis or something? I want to know, what do you have to do? Take the vaccine, or do you take tablets to treat the liver, or what? And then the second one, if you take the hepatitis, how do you call it, the screening test on the spot like that, is it enough for you to go and have the 3 doses of the hepatitis vaccine to protect you?
Okay. Amy, you have a point, but I thought you would have added that if you take the test and it is negative, right? But I'll bring that to my guest. Typically, you are vaccinating people who have not been exposed. Isn't that all right? Oh?
Yes, it should be those who are negative.
Yes, you must be negative, right? But I can see Amy has the Apple book that I was reading last night. But she's asking critical questions, right? So if the E antigen is high, what do you do? Should you and at what point do you take the treatment and so on and so forth? Are we there yet in this discussion?
Yeah. Thank you very much, Amy. When the E antigen is positive, it gives us an indication that it's likely that person got the infection from mother to child.
Okay.
Yes, and then secondly, it tells us that the amount of virus in the blood is going to be high. But treatment depends on whether there's inflammation ongoing.
Okay.
So we need the liver function test to help us decide whether this patient will require treatment or not.
Okay.
Because we have cases where the viral loads are in their millions, the liver function tests are normal.
All right.
We just monitor.
Okay, great stuff. This one says, you mentioned that it's not transmitted through sweat. Is it airborne? Because I was tested positive just a few months ago, and since then I have been wondering where I got it from. But I was told it's possible to catch it in the air. Joe, in Odoko.
Oh, Joe, you can't catch it in the air at all.
Hey, Joe.
It's not airborne.
No, it's not airborne at all.
It's not like COVID.
All right. This one says, can it be cured completely?
For C, yes.
No, B.
B.
For B,
No,
you can.
no, B, no.
Right. And do you have to pay to vaccinate a newly born baby whose mother is HBV positive?
Yes, if you are doing the birth dose, which is currently not being done at a national level, you need to buy it and then use it for your child. That's what we're pushing for.
All right.
For it to become part of the national immunization program.
All right. It's in the pipeline, as they say. Please, I tested positive, but I was told I'm inactive. What does this mean?
It means that the amount of virus in your blood is quite low. Your liver function test is normal at this time.
All right.
So what we need to do is to be monitoring you every 4 to 6 months to see if your defense system is still on top, suppressing the virus.
All right. Dagati in DC says, how sure is this testimony? I don't know whose testimony he's talking about. That herbal medicine can cure hepatitis or HBV.
We've not yet got any medicine to cure hepatitis B virus disease.
Yes,
but you see, the herbalists are going around saying that they have herbs that actually cure hepatitis B.
Right.
Some of them might manage the symptoms, and so once the patient gets the symptoms relieved, then he thinks that he's been cured.
All right.
Up to date, we don't have any medicine to cure hepatitis B. For C, yes, we have.
All right. All right. And we have, and they are herbal or they are not herbal?
No, they are
Orthodox medicine.
Right.
orthodox medicine.
Right. Okay. Yes, Doc.
Yes, I just want to add that when you have hepatitis, that is the time you want to stay away from medications that have not been proven to be safe for the liver. And many of our herbal preparations might not be very safe for the liver. They can only help to accelerate the damage to the liver.
Okay. All right, great stuff. You're hearing this on Ultimate Health Joy 99.7 FM. Good afternoon, Nortey. My wife is positive for hepatitis B, but she did an antigen E test and we're told she's merely a carrier. We have been married for about 7 years, but I keep testing every year. I tested a month ago and I'm still negative. Is there any cause to worry about her? This is Native in Weja.
Native, I think for her, she needs to be monitored every 4 to 6 months in terms of the liver function test, the viral load, another test, alpha-fetoprotein, and then the ultrasound scan to see if she hasn't developed any complication.
Okay.
Otherwise, he is fine.
You're fine.
Yeah.
All right, good. We're happy to say you're fine. All right. Nortey, my question hasn't been discharged. This is Chief from Boma. 2 of my children were immunized 10 and 11 years ago. Are they safe?
Yeah, they are safe. If they have had all the 3 vaccinations, normally during the childhood, they give them at 6 weeks, 10 weeks, and the 14th week.
All right.
Completely.
Okay.
If they have had those vaccinations,
Right.
then they are safe. The other thing that they can do to be more safer is to check their antibodies titer level.
Okay.
Then they know that really they have the immunity as it is.
Okay. Right. We're running out of time, but we do have the added option of a program next week to continue. But let me ask this question, which comes to vaccination. And I do this a lot and when I'm doing these kinds of campaigns and advocacy. Let's be clear. Who is an ideal indicative candidate for vaccination? Because we promote the vaccines. They're supposed to be complied with for the number of shots required to get the immunity. But it gives the impression that everybody can go for vaccination, right? Now, I made a point earlier, and I think you endorsed that you need to be negative, meaning that you have not been exposed for you to be a candidate for vaccination. Can we clarify that as we wrap up?
Exactly what you have said. Before you go for the vaccine, you need to be screened. And
All right.
if you are negative, the vaccine is to protect you so you don't get exposed.
Right. Okay.
And if you are negative, then once we are in a hyper-endemic state, you don't know when you get in touch with the virus.
Okay.
So it's indicated that when you are negative, take the opportunity and vaccinate yourself.
So if you don't know your status, you should not be presenting
No.
for vaccination, and you
Not
should not
at
actually be
all.
vaccinated by somebody who is qualified
Exactly.
and knows what we're talking about.
Yes, and
Right.
now there are people going around with all vaccines. Please get the vaccines at approved places because cold chain is very important. How the vaccines are kept, the source of the vaccine is very important.
Okay.
Otherwise, you may be given placebo, and you may think, you may have false hope that, I've been vaccinated.
Right.
No way. And then after your vaccination series, after you've done the 3, ideally try and test your antibody titers
Okay.
to see if the body picked it up. If you are immune,
Okay.
then you can be safe.
Right. All right. These are very important clarifications. Very often, the education and awareness is done without hitting on this. Some people sometimes think that it's the pharmaceutical companies that want to sell their vaccines and so on and so forth. But it's very, very critical when you're talking about immune system and immunity, right? If you want to be vaccinated, you should be negative. Otherwise, you are not a candidate for vaccination, and we will be wasting the vaccines, which are already expensive. All right. All right. So we're wrapping up, but with the promise of a program next week to look at treatment and vaccination in detail. Okay. We've talked about symptoms. We've talked about the types, right? We've mentioned and clarified emphatically that you need to be tested for us to say you have hepatitis. Right? Do these tests, when we do the screening, are they specific to the types or the virus?
Yes, so they are specific.
Right.
So, for instance, we have test kits for A, for B,
Okay.
for C, etc.
All right. So you'll be told which of the types you're being
Exactly.
tested for.
Yes.
All right. Does a person need to test for all the types?
Not necessarily.
Okay.
It's usually the B and C because
Okay.
when you have the chronic infection, it doesn't show until, as I said, complications have developed.
Okay.
The A and E, they cause acute, so you have all the symptoms.
Right.
And it's likely that when you visit a health facility, they may screen you for that.
Okay. Right. Does one need a booster dose 10 years after the initial?
What has happened over the years is that once you have the vaccination, the body itself regenerates itself and is able to provide more hepatitis antibodies. So the person do not need a booster dose. However, if for one reason or the other the person feels a little bit unwell, and he want to find out what is happening, he can still go ahead and do the antibody titer level to find out whether the levels are within the normal range.
Right. Okie dokie. I've done all my boosters on my WhatsApp, so I think I am immune when it comes to WhatsApp. But I know next week we must get into treatment. I know many people default. They don't finish treatment. Many people also do not finish the full series of the vaccination. It has to do with money. It has to do with many other things. And if we want to live up to what the theme says, to bring hepatitis care closer to everybody, we all need to understand these things. But one of the things I think the copy line under the theme was that hepatitis can't wait. It's not something you procrastinate and postpone. Check and know your status, know your numbers, and then you know whether you are putting somebody close to you at risk, especially when there's serial monogamy and other things. So it's important to know these things and take them seriously. Can I have some quick, brief words from each of you so we wrap up? Just quickly.
Yeah, thank you very much. When it comes to screening, I just want to encourage people that hepatitis C is treatable, and we are looking forward to an opportunity to get free drug treatment for hepatitis C. So we would like to encourage people to screen for hepatitis C so that they know their status and take advantage of this free treatment that may become available not long from now. Thank you.
All right. Okay. Yes.
Yeah, to all my viewers, hepatitis B and C still remains a silent killer, especially in our part of the world.
Right.
If you don't know your status, please go check your hepatitis status. If you've ever tested positive, don't stay at home.
Right.
Please visit the healthcare and be monitored.
Okie dokie. Steve.
And I will say that those who go and do the test and becomes negative, please don't sit down. Make sure that you go and get the vaccine.
Right.
And make sure that you complete the 3 doses.
Okay.
So that you can get the protection that you need.
Okay. Great stuff. Steve Kokwe, Dr. Adjoa J. Nkansa, and Dr. Godwin Siakekwewu, right? They've been giving us the basics when it comes to hepatitis. Next week, I will delve into treatment, vaccination, and even disclosure. When you know your status, who should you be telling? Who should you be sharing with? It's a big pillar in the care and protection. Stick and stay on Joy 99.7 FM. My name is Nortey by nature, produced by Abeku Sankofi. There's a lot of exciting stuff coming up after this. Don't go anywhere.